something that they're concerned about?
I have hearing loss, and I need to get hearing aids.
But you have not gotten hearing aids yet?
No.
Okay, is that because of a price concern?
Yes.
Okay. Any history of epilepsy, Parkinson's, or Alzheimer's dementia in your family?
No.
Okay. Do you ever have dizziness?
No.
Do you ever have headaches?
No.
A sore neck?
No.
Fainting?
No.
Any history of paralysis?
No.
Can you tell me your name and date of birth?
Virginia Purdy, 7/26/55,
And where are you right now?
in Altamont Springs, Florida.
What is today's date?
Today is June 20th.
Any recent changes to your mood or attention?
No.
Any changes to speech or memory?
No.
Any changes to judgment?
No.
Any depression or irritability?
No.
Any changes to vision?
Progressively, my eyes have been getting worse.
With age-related changes?
Age, yes.
Okay. And those are corrected with glasses?
Yes.
Any auras or halos that you see around you?
No.
Any facial flushing that you've noticed?
No.
Okay. I'm going to ask you a few more questions. How are apples and oranges related?
They're both fruit.
Can you count backwards by sevens from 100 for me?
No.
Can you count backwards by fives from 20 to 0?
Certainly. 20, 15, 10, 5, 0.
Perfect. I want you to go ahead and tilt your head to the left. Any pain? Any strain?
No.
Go ahead and put your head forward and then tilt it to the right. Any pain or strain?
No.
Who was the first president of the United States?
George Washington.
Who are the last 4 presidents of the United States?
Bush, Clinton, Obama, and Trump.
Okay. What would you do if you found an envelope that had an address and a stamp on it on the sidewalk?
Probably throw it in the mailbox.
Okay. I'm going to say 4 words. I want you to remember them and repeat them back to me. Burger, tulip, nose, tea.
Burger, tulip, nose, tea.
What subjects are you interested in currently?
Subjects?
What do you enjoy reading about or watching movies on?
Self-help books and movies on documentaries.
Perfect. I'm going to go ahead and hold this up to your left nostril. Can you smell it?
Yes.
And your right nostril?
Yes.
Perfect. I'm going to go ahead and have you look 20 feet in front of you, where I'll be standing over here with this sheet. Can you read these letters to me with your eyes both open? You can put your glasses on.
DEFPOTEC.
Perfect. Can you read the line below that?
No.
What color is this?
Red.
What color is this?
Green.
Go ahead and cover your left eye and read those letters to me again.
DEFPOTEC.
Can you read any lower?
No.
Go ahead and cover your right eye and read these letters for me.
DEFPOTEC.
Can you read any lower?
No.
Okay, perfect. I'm just going to go ahead and take a look at your eyes now with my ophthalmoscope. And I'm also going to be checking for pupil reaction. Go ahead and look directly at me. Perfect. And look directly at me. Perfect. Okay, the optic fundi looks good as well. I'm going to go ahead and check your eye movement now. What I want you to do is follow my finger with your eyes. Over here. Good. Perfect. Okay. Right now, I'm just going to go ahead and check your head and your face and your scalp. What I'm looking for is just to make sure that everything looks symmetric, that I don't see any signs of facial droop or any malformities in the skull structure. Perfect. Now what I'm going to do is I'm going to go ahead and do the Weber test on you. So what I want you to do is to tell me, can you hear this on your right side, your right ear?
Yes.
Your left ear?
Yes.
Tell me when it stops ringing.
Stopped raining.
Perfect. Now we're going to go ahead and check your gag reflex. I want you to go ahead and just let me depress your tongue down. Say ah. Perfect. Put your tongue up towards the roof of your mouth, down towards the bottom of your mouth, to the left, to the right, and totally out in front of you. Perfect. Okay. Now what I'd like you to do is I'm going to try to resist to your shoulders. I want you to shrug them up to your ears. Perfect. Now, put them down. I want you to turn your head to the left with me resisting it. Good. Back to center. Turn your head to the right with me resisting it. Good. Back to center. Any tenderness or pain there?
No.
Okay. Now I'm going to go ahead and check your reflexes. I'm just going to have you go ahead and put your elbow down here. Okay. Okay, good. Go ahead and have you put your elbow down here. Okay, good. Inside the wrist over here. Good. And inside the wrist over here. And good. Okay. Now I'm going to go ahead and check your reflexes on your knees. Here we go. Okay. 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 Now what I'm going to have you do is I'm going to have you lay face down on the couch so I can test the reflexes on the back of your ankles. Yes, please. Okay, perfect. Okay, you can go ahead and sit back up at the exam table. Okay, now what I want you to do is close your eyes and I want you to take your left hand and touch your finger to your nose. And put it back down. Now, touch your right finger to your nose and put it back down. I want you to go ahead and stand up and take your shoes off. I want you to run your foot up and down your shin like this. Good. Okay, and now on the other side. Perfect. Now you can go ahead and sit back down in the chair and I want you to put your hands on your knees like this and rapidly turn them. Perfect. Okay. Now I'm going to have you close your eyes and I want you to tell me what object I'm placing in your hand. Okay, go ahead and turn your hands over. What does that feel like to you?
A fork.
Perfect. What does this feel like to you?
A popsicle stick.
And what does this feel like to you?
Tweezers.
Perfect. Now what we're going to do is I'm going to be using, you can open your eyes, I'm going to be using 3 different objects. I'm going to be using a cotton ball, I'm going to be using a Q-tip, and I'm going to be using a pair of tweezers. I'm going to be touching you on the chest, the arms, and the legs. I want you to close your eyes and tell me, is it a Q-tip, a cotton ball, or tweezers? Okay?
Cotton ball. Tweezers. Tweezers. Q-tip. Q-tip. Tweezers. Cotton ball.
Okay, perfect. Now I want you to close your eyes and I want you to put your hands out in front of you. Tell me if I'm moving your fingers up or down.
Up.
Okay.
Down.
Perfect. Now I want you to go ahead and stand up for me and I'd like you to walk from here to the table. I just want to go ahead and see your gait. Perfect. Turn around and walk back towards me. Wonderful. I'll go ahead and have you take a seat. I want to check your strength now. So what I'm going to do is I'm going to have you pull your hands up like this to your chest and I want you to push them back down towards me. Perfect. Now I want you to try to pull my hands up towards your chest. You can have your eyes open. Good. Okay. Now I want you to go ahead and try to push your legs up towards me. Good. On the other side. Perfect. Now I want you to try to pull them back towards your body. Good. Okay. Now I'm going to just go ahead and put the tweezers to your face. Can you feel that?
Yes.
Can you feel that?
Yes.
Can you feel this?
Yes.
And here?
Yes.
Perfect. Okay. Now what I'm just going to do is I'm just going to sweep this under the eye. Look straight at me. Okay. Now what I want you to do is go ahead and raise your eyebrows for me. Now look angry. Now smile. And now look sad. Okay, perfect. Okay. That completes our neurological assessment today. Thank you so much.